three different areas. First of all, we are going to check whether or not there is an anterior or a posterior difference between the left and the right foot. We're also going to check whether there is an eversion or an inversion difference between the left and the right. And lastly, we're going to check if there is any rotation of the foot. You need to write these down in your notes. Next is the lateral observation standing. For demonstration purposes only, I will maintain close distance between myself and the client. In practice, to gain a more accurate observation, you can stand 1 to 5 metres away from your client. Mark, could I please have you turn to your right so that your shoulder is facing me? Thank you. We're going to check through the midline of our client's body using our hand as a guideline. Please note that we check bilaterally, so we will check both the right and the left-hand side of their body. First of all, we are going to go through the mastoid process, down through to the shoulder. We're going through down into the hip line, through down to the knee, and we will finish at the ankle. During this time, we are to take note of any anterior or posterior findings in these areas. Next, we are going to do the spinal curvature. We are going to look for kyphosis, lordosis, and scoliosis. This is an example of the spinal column. As you can see, there is a definite scoliosis happening here in the thoracic area. Kyphosis is in the thoracic area and lordosis is in the lumbar region. Visceral ptosis. We are now looking to see if there is any abdomen protrusion in the anterior aspect of their body. Anterior buttock. So again, we are looking at their lateral view to see whether or not there is any anterior buttock present. Write these findings down in your notes. This is your posterior observation and palpation standing. We start with the ear level, and to perform this test, we can use our fingers as a gauge to whether or not there is a superior or inferior difference bilaterally. Then we go to the shoulder level. You can use observation only, or you can use your hands to check for the levels on the shoulders. Next is the level of the hands. We use the middle finger as a gauge to the level for the client. Again, you can use your fingers to check the level. We go up to the scapula, the apex of the scapula, and again you need to palpate the person's tissues to identify that area of the body. I'm using the fingers again to identify if there is any difference of the levels. The spinal curvature. We check again by using palpation either side of the spine. We are running our fingers down the spine to find any detection of scoliosis, again if there is any kyphosis, or any lordosis in the lumbar region. Before I palpate the client's iliac crest and PSIS, I will identify these on the spine. These are your iliac crests, and here is your PSIS. Before palpation on the iliac crest, check with your client that they aren't ticklish in this area or that there is no tenderness in this area before you palpate. Is there any tenderness there, Mark? You need to use a firm pressure to identify where the iliac crest lay. And again, I'm using my fingers as a guideline to the levels. You then move around to the PSIS, checking the levels again, and you ask your client to bend forward as far as they can go, making sure that the PSIS moves freely and evenly, and up again. Thank you, Mark. This is the posterior observation and palpation sitting. We will go through the same techniques used in the standing phase. We are to note whether or not any changes have been made from their standing to their sitting position. First of all, we do the ear level, checking whether or not it is superior or inferior bilaterally. We check the shoulder level. We go down to the apex of the scapula. We then go to the iliac crest, following through to the PSIS. This is your active range of motion with your client. This is to detect whether or not there is any pain or restrictions in the joints of the body. First of all, we will ask the client to do a forward flexion of the spine. If you can reach down as far as you can, Mark, reaching down with your hand. We are checking if there is any bilateral restriction or any restriction in that movement at all. Was there any pain or restriction for you, Mark? No. Great. Now we'll do the lateral flexion of the spine. So it's going down as far as you can. Take note of where his hand travels, how far it goes down. And again, you need to check with your client whether or not there is any pain or restriction upon doing this movement. You fine, Mark? Yeah. Great. The arm raising. We're going to ask Mark to raise his arms to his shoulder level, turn his palms upwards and go and extend above his head. Bring his hands down forward, together, and here I will be checking the level of his fingers. This is another indication of whether or not there is a part of his body that is superior or inferior. You can write that down in your findings. Next we will check the client's knees. Mark, if I can get you raise one knee at a time and flex and extend. Is there any pain or restriction? No. Great. And again on the other side. Always checking bilaterally. Wonderful. And then we will do the ankles of the client's body. So again, Mark, if you can lift your leg, if you can rotate left and right, extend and flex. No pain, no restriction. And if you could repeat that on your other side. Great. Rotate and clockwise. Wonderful. Thank you. You need to write your findings down on your postural analysis form. This is your passive range of motion. With the passive range of motion, you are going through these techniques for the client. First of all, you need to check whether or not there are any pain or restrictions, and you need to go through these techniques very slowly and gently with your client so as to avoid any pressures or pain added to their existing condition. Mark, I'm now just going to take your wrist and I'm going to go through these techniques. At any stage, if you feel any pain or restriction, please let me know. You put one hand on their shoulder, you gently take up their arm to the midline, you go up and above their head and slowly down again. You need to stop this process when the person indicates that they are in any pain or restriction. Normally you check this bilaterally, but for these purposes I will show you on one side only. You will then go down to the client's knee, supporting the top of their knee with your left hand and elevating his leg by extension of his lower limb with your right. Is there any pain or restriction with that movement? Great. You will then bring your left hand to support their ankle, taking your right hand and placing it under their foot. You will rotate clockwise and anti-clockwise. Any pain or restriction there? Great. You will dorsiflexion the foot and plantiflexion. And that is the end of the passive range of motion. This concludes the postural analysis physical examination. We will discuss this more in depth at a workshop.
This comes to the end of the physical exams that we'll be demonstrating today. During your studies at the Naturopathic College of New Zealand, you will also be introduced to iris diagnosis, tongue diagnosis, and using height and weight to work out someone's body mass index. Please start practicing the skills that are on the DVD in preparation for your Year 2 workshop. We look forward to seeing you then, and please, if you have any more queries about the practice of physical exams, don't hesitate to call the tutors at the college. Thank you.